Hello, welcome to Sonography Radiology Training channel. This series of videos is about normal skull X-ray findings. This is the third video in this video series with title of Normal Skull X-ray Findings Simulate Disease Part 3. Like previous videos, we will review a few cases together. Case 1. This frontal skull X-ray view shows a partially well-defined lucency with a thick lucent band. What do you think? At first it seems we have an distractive lytic lesion, but really it's a Pacchionian granulation, and the image shows lucent depression of a Pacchionian granulation with a large draining vein. Arachnoid granulations, also known as Pacchionian granulations, are projections of the arachnoid membrane into the dural sinuses that allow CSF to pass from the subarachnoid space into the venous system. They increase in size and number with age and are seen in approximately 2/3 of patients. They most frequently occur in a parasagittal location, with the transverse and superior sagittal sinuses being the most common locations. The granulations typically occur next to the entrance of a superficial draining cortical vein into the sinus, similar to colonic diverticula occurring next to the penetrating vessels. Another examples of Pacchionian granulation. Here we can see a rather poorly defined Pacchionian depression simulating a distractive lesion, particularly in the lateral projection. Another example, here we can see typical Pacchionian depression in the frontal bone. In the frontal view, this lucency is often mistaken for a distractive lesion, because we can see here a lytic lesion with wide transition zone. Another example, this image shows deep but typical Pacchionian depressions. The external table of the calvaria is bowed and the internal table is apparently absent. Failure to appreciate these features may lead to an erroneous diagnosis of erosion of the inner table of the skull. Another example, here we can see Pacchionian depressions, which is an unusual location for this normal entity. Case 2. This image shows multiple discrete bony fragments along the cranial sutures in a 7-year-old child, and as we know, they are Wormian bones. Wormian bones, also known as intrasutural bones, is the name given to the additional small bones or bone islands sometimes found between the cranial sutures, most commonly in relation to lambdoid suture. Some references reserve the term Wormian bones to just the intrasutural bones proximate to the lambdoid suture, and some consider them abnormal only if they are greater than 10 in number. Wormian bones can be idiopathic or anatomical variant, but there are many associations with them, including Pyknodysostosis, Osteogenesis imperfecta, Rickets disease, Menkes disease or Kindi-Higher Kindi vessel syndrome, cleidocranial diastosis, hypothyroidism, hypophosphatasia, autopalatodigital syndrome, primary acroostolysis or Hajdu-Cheney syndrome, pachydermoperiostosis, progeria, and also Down syndrome. We can see Wormian bones in many locations. The most common location is lambdoid suture, as I explained before. There are some Wormian bones with a specific name. One of them is lambda or Inca bone, also known as peri-interparietal bone, os Inca, Goethes ossicle, and os epactal, which is a triangular sutural bone located at the previous site of posterior fontanelle. It's common and a normal variant. Another important location is pterion, which up to 12% of Wormian bones may be seen in pterion. The pterion is the edge-shaped formation of sutures on the side of the calvarium representing the junction of four skull bones, including the greater wing of sphenoid bone, a squamous portion of the temporal bone, frontal bone, and parietal bone. It's one of the skull landmarks or craniometric points for radiological and anthropological measurement. This image shows Wormian bones at the base of the coronal suture in a newborn, famous as epitheric bones, which they are Wormian bones in pterion. Another location is sagittal and coronal suture bones, which is uncommon. This image shows a Wormian bone in sagittal sinus, which is famous as anterior fontanelle bone. Wormian bones in the fontanelle are uncommon, and when they occur, they are mostly seen in the posterior fontanelle and, as I explained, famous as lambda bone. Wormian bones in the anterior fontanelle are rare. Now, we can review a few cases of anterior fontanelle bone. These images show fusing anterior fontanelle bone in a 3-year-old boy. This appearance may be confused with that of a depressed fracture in the lateral projection. We can see here anterior fontanelle bone in a 5-year-old boy. Note its characteristic appearance in Townes projection. Another example which shows closing anterior fontanelle bone in an 11-year-old boy. And another example, we can see remnants of the anterior fontanelle bone in a 50-year-old man. Now, I suggest 2 others of my videos that are close to this video in terms of matter. And thank you for your attention.